Recommendations to minimize COVID-19 transmission. Case study, local transport. In this video, we will show you how to assess and manage the risk of COVID-19 transmission in local transport. The COVID-19 virus is transmitted via 3 routes, essentially through aerosols, droplets, and to a lesser extent through contact with contaminated surfaces. The level of transmission risk depends on a combination of 5 factors: ventilation, safety distance, use of face mask, exposure time, and relative humidity. The combination of these factors and whether or not they are managed correctly influences the transmission risk level, which can be low, medium, or high. In the next few minutes, we will show you the risk map of local transport and examples of situations where there is a risk of COVID-19 transmission due to the poor management of the 5 factors mentioned. These examples consider droplet and aerosol transmission of the virus, as they are the most common transmission routes and present situations of maximum risk. Furthermore, they will help you learn about the most appropriate preventive measures in terms of ventilation, safety distance, use of face mask, and exposure time. With regards to relative humidity, this should be kept between 40% and 60% in all instances by using air conditioning, humidification, and dehumidification systems. Let us now take a look at these high-risk situations of COVID-19 transmission and the recommended preventive measures in each case. Risk Node 1, Terminal, Tickets, Sale Area. The terminal where we are located is in a closed space with a large influx of people. It has some windows, but they are usually closed. The air conditioning is turned on and recirculates indoor air. Ticket sales are concentrated at 2 counters, which in addition to selling tickets, operate as an information center for the users. Long lines are formed and safety distance is not respected by customers or during their interactions with the ticket office staff. At the terminal, it is mandatory to keep your face mask on at all times, but nobody controls it. Although the staff may wear one, many passengers wear their masks below their nose. The average time a user spends in line is about 15 minutes. Recommendations to reduce transmission risk. Ensure sufficient ventilation at the terminal. Keep the doors open, generating drafts if possible. Turn on the air conditioner to replace the greatest amount of dirty air with clean air, avoiding recirculation mode. Define the maximum capacity of the terminal, communicate it, and control it. Encourage staff and clients to maintain the safety distance at all times and install protective screens to prevent transmission via droplets. Enforce the correct and continued use of face masks. If necessary, reorganize ticket sales to avoid crowds by opening distant counters or promoting online and machine ticket sales. Risk Node 2, Terminal, Waiting Area. In the waiting area, there is no air renewal. The air is recirculated. Signs call for users to keep the safety distance in the waiting area, but in general, they are not respected. Most users do not wear correctly the face mask and spend between 15 to 30 minutes in the waiting area for their bus. Recommendations to reduce transmission risk? To minimize transmission risk, in addition to the recommendations mentioned before regarding ventilation, safety distance, and the use of face masks, establish, communicate, and control the maximum time that users can occupy the terminal. Reorganize the waiting area to create outdoor spaces whenever possible. Risk Node 3, Inside the bus. The bus does not have air conditioning. Some windows open when the bus is in motion. The vehicle circulates at full capacity, and the safety distance is not respected, not even from the driver. Although wearing a face mask is mandatory, not all passengers wear an adequate face mask in good conditions. Most passengers stay an average of 30 minutes inside the bus. Recommendations to reduce transmission risk. Open all windows and lock them open, including the top window if available. Communicate users not to close those windows and check that they comply with it. Define the maximum capacity that allows maintaining the safety distance. Identify available seats and spaces to be standing within the bus. Enable only one access door, only one exit door for passengers. Encourage passengers to wear their face mask correctly, always covering their nose and mouth. Staff must enforce compliance. Provide N95 face masks to the drivers. Protect the driver by additionally installing a protective screen. The aforementioned measures are aimed at minimizing the risk of droplet and aerosol transmission. With regards to transmission through contact with infected surfaces, it is recommended facilitate hand sanitizing among staff and users with soap, water, and single-use hand towels. Empty waste baskets daily, and keep the facilities in a clean and hygienic condition. This video only shows a summary of the most relevant recommendations for high-risk situations. There is a specific tool available to help you carry out a personalized risk assessment for your establishment. You will be given the most appropriate preventive measures to implement in each case, depending on the result of your risk assessment. We encourage you to learn more about this tool at www.iadb.org/tourism protocols.